Whether you're putting a hernia mesh in or doing a cancer surgery or doing a knee replacement, infection is the thing all surgeons fear more than anything else. We know how to deal with the cancer and how to get it out. What we don't know how to mitigate is once that infection takes hold, it's a disaster. And so we got into this space of infection work and trying to figure out kind of how we could make patients more ready for surgery. And that opened all these incredible doors. We found out that, and really proved in a mechanistic mouse model, that somebody's vitamin D level going into surgery absolutely predicts their risk of having infection. If they have a low vitamin D level going in, I mean, this is like basic no risk stuff. They have a massively higher risk of infection. And that if you give them vitamin D prior to surgery, just prior to surgery, forget vitamin D their whole life, you can bring that risk back down to what the normal baseline population is. Just as an aside, if you get a joint replacement and you get an infection with that joint replacement, your likelihood of survival is worse than being diagnosed with breast cancer, multiple myeloma, or HIV.
Damn.
Right? You have a higher chance of dying in the next 5 years with that than any of those diagnoses. I mean, this is serious, life-changing stuff.
This gets me so angry. This gets me so angry. I thought about this last night. This is just so barbaric. When I'll have a patient presenting to clinic and they need a clearance for surgery for some minor procedure, so their team was asked to get lab work done by their primary care. And a lot of times it's for the anesthesiologist. And what are they looking for? Sodium, potassium, renal clearance, stuff like that for anesthesia. But they're not looking at you as a human being. They asked to comment on is just, it's just, can you believe we're saying these things? And that guy in there he's very authentic. Like, this is no money. This is no brainer. Run the damn vitamin D. It's rare that I see a normal serum vitamin D in the patients. And I test vitamin D every 6 months to a year with my patients. I just do. Because it's one of those things that is chronically low in people. And that's lab work, guys. It's not like weird. That's just truly true. We know that people who have low levels of ascorbic acid or low levels of vitamin C, they don't heal as well. We know people who have low levels of healthy growth hormone, not super physiological, not bodybuilding, nothing weird, but like talking what you're supposed to have growth hormone. When it's low, you don't recover very well. We know people who have high blood sugar, they don't recover well. We know across the board all the things, magnesium, manganese. These are all things that can be tested so easily in your labs. They're not expensive either. They're not expensive. Those supplements are not expensive, and it's so easy to test them. And people would say, well, it's not true. The research is there. The research is there. And I dare any doctor to say it isn't. The research is there that serum levels of low levels of magnesium have poor outcomes, higher blood sugar has poor outcomes, low vitamin C has poor outcomes, low vitamin D has low outcomes. And how they run those tests, those studies, is they run the lab on the people that have the procedure and they verify outcomes. So the lab is an effective tool to prevent harm. So many surgeons bring their patients back, do the procedure. They only want to make sure they survive the table because that's what the anesthesiologist is doing. That's the job. And they're doing that and they need to do that. And God bless them. That's what they're doing. That's good. But if we want to be smart and earn your trust as physicians, we think about all of you, not just, hey, I got the knee replacement coming in. That'll be another boat payment. That sounded evil when I said that. That's how I feel sometimes about it. When people have endometriosis and they would do laparoscopic surgery on them, when you stick a camera in someone's, body, you run the risk of adhesions, which is when, you put a camera through there, your body is not used to having a camera running through there. It's like, what is this here? And so when that goes through your body, you're triggering the immune system. The immune system is going to try and make scar tissue around that. And that's where you start seeing patients have adhesions. That's a real thing. It's a real thing. And how do you prevent that? A lot of times you can't because you're doing a surgery and you're just risking that period. Scar tissue occurs with surgery anywhere that you went in the body, not just on the skin, but anywhere in the body. And even the one on the skin you did that scar tissue can penetrate deeper into the body, creating problems. People, if you have scars, some of you have scar pain associated with you have scarring, you'll know that occurs. So, antioxidants, yes. There's enzymes that help break down cross-linking of the scar tissue. There's certain things you can do that are helpful preventing that. And that, again, is such an easy thing for a doctor to know. We had to learn this. We had to learn how scars are formed and why people make scars rather than healthy collagen. We had to learn this stuff in med school. This is not advanced. This is basic stuff for us. We should all know it. And so when your doctor prescribes, a procedure on you, the doctor should be also prescribing or running lab work to verify your health, to make sure you'll do well with it with minimal side effects, and then monitoring you afterwards and making sure they do support therapies post-procedure, not just saying you got over your anesthetic, you're good. It's like, let's do better than that. Yes, proper nutrients, proper nutrition, proper micronutrition, proper trace elements, proper antioxidants, all are essential to procedures and having surgery done. And with that said, just to living healthy. So this is heartfelt is a good real